Domain 2, quality assurance and radiology regulations. This is weighted at 21%. A is quality assurance. Basically, this is how are we caring for things? How are we making sure that everything is remaining good quality and is going to be diagnostic and able to be used? So evaluating storage, preparing, maintaining, and replenishing automatic processor solutions. How do we implement quality assurance procedure? What are those steps that we are taking to make sure that everything is working properly? B is radiology regulations. So describing how to prepare radiographic images for legal requirements, viewing, duplication, and transfer. How does HIPAA affect how we do these things? 2 is describing how to store chemical agents. How do we stay in compliance with the Occupational Safety and Health Administration, or OSHA? How do we dispose of chemicals and other materials? And how do you understand federal and state regulations that apply to procedures and equipment? Domain 3 is radiation safety for patients and operators and is worth 31%. This is the most heavily weighted domain, and because safety is big. We need to know that your patients are going to be protected. We need to know that you are going to be protected. So this is a big component of the radiology exam. So A is identify current American Dental Association guidelines for patient selection and limiting radiation exposure. What steps do we need to take to make sure that that patient is being exposed to the least amount of radiation as possible? B, apply the principles of radiation protection and hazards in the operation and location of radiographic equipment. So, what factors affect X-ray production? What are the X-radiation characteristics? What X-ray machine factors influence radiation safety? So, how is the machine doing its part to protect us? Radiation physics. What's the difference between primary radiation and scatter radiation, primary radiation and secondary radiation? What is the protocol for when we think that a machine might be malfunctioning, and treatment and surrounding areas? So what do we do with the walls, the hallways, the other operatories? C, demonstrate knowledge of patient safety measures to provide protection from X radiation. What are the causes of unnecessary X radiation exposure? What happens, X-ray radiation biology? What happens to our bodies as we are exposed to radiation over and over again? D is address patient radiation concerns. So these would be, how do we handle when our patient may be objecting? E is identify operator safety measures to provide protection from X radiation. So where does radiation come from that may hurt the operator? How do we protect ourselves? And how does physics and biology affect the operator as well? And F is describe methods for monitoring operator exposure to X radiation. And domain 4 is infection control. How do we keep everything safe from spreading disease? A is standard precautions for equipment. So we're going to follow all of the guidelines from the American Dental Association, Center for Disease Control and Prevention, and all OSHA guidelines for conventional and digital radiography. And we're going to demonstrate understanding of barriers used to minimize cross-contamination. And B, standard precautions for patients and operators, demonstrating the understanding of infection control for radiographic procedures according to the American Dental Association, the CDC, and OSHA guidelines for conventional and digital radiography, and then describe infection control techniques used during radiographic processing, following all of those guidelines again.